family physicians and general practitioners is very important. And that's the reason why Rajiv Gandhi Institute of Health Sciences has taken up this uh, onus of training through online all the segments of the healthcare professionals. We have been doing this right from the day uh, the lockdown was implemented, and so far we have covered all the doctors, all segments of doctors, be it in critical care or intensivist or anesthesiologist or for that matter microbiologists, pathologists. Uh, everybody has been touched, even public health experts. So we were also contemplating on having a dialogue with family physicians. Not that we need to teach about COVID-19, because all of you are well aware of it. You had the uh, opportunity to learn about COVID-19 through many sources. What we are trying to focus today is to see what is the role to be played by family physicians during the pandemic. That is what we are in the present situation. And what is our role post-lockdown or post-pandemic? The situation is going to change quite a lot. So what is your role and what are the protocols to be followed? What are the standing operating procedures to be followed? That is what is going to be addressed. I'm sure all of your role is very important in furthering the cause of the fight against COVID-19. And any war can be won only with the total contribution from every single aspect of healthcare workers, especially so in COVID-19 situation. And that's the reason we are trying to reach out to everybody. And today we have with us Colonel Dr. Mohan Kubendra. As you all know, is the National Vice President of Family Physicians Association of India. He would be talking about role of GPs during COVID-19 pandemic and the related infodemic. Dr. Roshni Jan Ganguly, Executive Member AFPI, she will be talking to us on teleconsultation and triaging of patients in clinic. Dr. Swapna Bhaskar, who is also well known to you, she is the President of Association of Family Physicians of Karnataka, India, Karnataka chapter, and she will be talking about management of clinic and well-being of general practitioners during COVID. Dr. Soumya B. Ramesh, Executive Member of AFPI, Karnataka, she will be addressing you on PPE for GPs and role of GP in community prevention of COVID. So all these are very important topics. I'm sure at the end of the day, you will be getting a lot of inputs, a lot of take-home messages, which would be practical points, practical tips for you to follow when you restart your clinic, or probably some of you might be running your clinics. So what are the things that need to be followed in your clinic? And if at all you are not started, it is time to start. Unlike other state governments, Karnataka government has never asked anybody to close the clinics. Only with certain guidelines, you could have run the clinics. But many have, due to whatever misinformation or fear of COVID, many have closed the clinic entirely. But this is the time to reopen, but reopen with some, guidelines that you need to follow, which I think will be the topic in this discussion. And henceforth, run the clinic with all the necessary protocols. That being the case, probably all of you will be contributing a lot towards prevention of spread of COVID and also containment of COVID in the near future. So with that in mind, I thank all of you, all the presidents and office bearers of Family Physician of India, Karnataka chapter, for coming forward to being with us, partnering with us. Rajiv Gandhi University of Health Sciences has a role as a university, has a role to play in any issue that is concerned with health of the state. So that being the case, today's program, I'm sure all of you would benefit out of it. And I appeal to all of you to lend your services whenever the government desires, so that we can, all together, we can fight against this pandemic. Thank you so much. Without wasting much time, I would request Colonel Mohan Kubendra to take over and give us lecture.
Thank you, sir. Good afternoon, viewers. At the outset, I would like to raise and record our sincere gratitude to the Honorable Vice Chancellor of Rajiv Gandhi University for Health Sciences for having invited us to share our insights and training the family physicians in the COVID scenario. I am very thoughtful of the university to involve the frontline caretakers, the family physicians, in the scheme of things. This probably the first time the university is involved the family physicians in the education program. We are really grateful to you. So, as we all are aware, the world has witnessed, still witnessing, uh, an unprecedented catastrophe for the last 2 months, with an unprecedented despair, disbelief, uncertainty, mortality, and morbidity. As on date, nearly about 3 million, that is 30 lakh people have been infected with COVID virus globally, out of which nearly 2 lakh people have lost their life as a consequence of the complications of this deadly virus. As far as India is concerned, compared to many other countries, including the most developed nations, I think we are doing reasonably well at this stage, with around 28,000 persons infected as on date and around 870 deaths so far. Today, we are going to discuss what is the role of a family physician in the current pandemic. So, at the end of the session, the participants will be able to understand how we can manage the flow of information, which is very important, and contain this infodemic, and how we can undertake triage of your patients, and how what are the teleconsultation process, what are the guidelines, and you'll be able to develop a strategy for your own practice for managing your clinical practice. Also plan a well-being for yourself, staff, and the community you serve. And very importantly, the use of the personal protective equipments so that you can minimize the risk of transmission to the community. And also, you'll understand what are the strategies and what you can do in the post-COVID period for your clinical practice. So with me, as already the Honorable Vice Chancellor has introduced, I have with me the office bearers of AFPI. We have very experienced family physicians in Dr. Swapna Bhaskar, who is the head of the department, family medicine from St. Philomena's Hospital. Dr. Roshni, she is a practicing family physician from East Bangalore. Dr. Soumya Vivek is a chief medical officer from Sindhi Hospital. So, as we all understand, that every section of the society is affected by this pandemic, but certain sections of the society are at a greater risk. In the list, probably the medical professionals will top the list. So far, till now, the focus has been on the hospital-based practitioners. Rightly so, because so far the pandemic was restricted to, at least in India, the cases, the positive cases were basically those with a positive history of travel or the close contacts of these patients. So the focus has been on the intensivists, on the pulmonologists, on the anesthesiologists, on the emergency medicine doctors, and the internists. But now, if what is feared or what is expected, that probably we might witness community transmission. That is when the role of family physicians, the focus will shift towards the community-based practitioners. We cannot forget that the first doctor who was tested positive in Karnataka was a family physician, and the first doctor who died due to COVID infection was another family physician from Surat. So we as family practitioners have a great role because we are a very vulnerable link. The general practitioners and the clinics in India are a vulnerable link in the chain of transmission. As you are aware, almost 60 to 70% of the people seeking health care visit the family physicians first. They are the first point of contact. So we have a great role in containing this pandemic, if not containing, at least reduce the risk of transmission. So in this background, the family physicians have a dilemma whether should we uh, open our clinic, we should have a full-time practice as before this pandemic was announced, or should we switch over to just a partial opening of the clinic where you do a triage through telephonic consultation and then call only those patients who are required to be seen by the family physicians to the clinic, or should we not open the clinic at all? As on that, you must have noticed that most of the private clinics, general practitioners have closed their clinics. Very few are opening the clinics partially, and most of them have switched over to the online mode of consultation. So we are going to discuss, in case if you are opening the clinic, what are the protocols we need to follow, and what are the precautions we should be taking, and what is, and if you are switching, if you are doing teleconsultations, what are the protocols to be followed, to be, and what kind of training you require. All this will be discussed by the other speakers. Another important aspect in the ongoing pandemic is to manage the information flow. So the information about the COVID is, it's like a flood. You open any social media, you get the messages and the expert opinions. So we are not sure as to what to believe and what is the authentic source of information. So as general practitioners, we have a great role in channelizing this information, both as a member of a professional fraternity as well as a family physicians guiding your own patients and the community around your practice area. First thing is that we should all be informed. Take all necessary precautions, but don't panic yourself. Don't panic yourself, and also don't allow the patients and your own the community around you also to panic with this flow of information. Also, there is a global epidemic of misinformations, and there are certain myths associated with this pandemic. So we as general practitioners have a great role in educating our patients and the community about the misinformation. The WHO has termed this as infodemic. So it is as dreadful and as difficult to contain as the pandemic itself. So it's time for all of us, especially as family physicians, to shoulder a social responsibility in combating this infodemic. So how can we possibly contain this infodemic? As a member of a professional body, as a member of the fraternity, we have a responsibility in restricting the flow of information. So what I would suggest is maybe it is time to mute all our social media groups and stick to only one or two professional groups to keep yourself connected and keep yourself accessible to information. So maybe one group of your own specialty or your own group, and another maybe IMA group. So these are the only three groups which you should be part of. Rest all, I think it's time to mute and advise members to refer only the authentic source of information. So I'll come to that little later on, and channelize the information among the members. The group admins have a great responsibility in channelizing the information. They should have a clear-cut policy on what is to be shared and what is not to be shared. Only information from the authentic sources needs to be shared in the group. These days, we are seeing a trend wherein the noted, renowned physicians with a little experience with the ongoing pandemic, they are creating videos and sharing it in the groups. So this is leading to the professionals discussing about such videos. So what I would recommend is that you should restrict to only the informations from the authentic sources only. As a family physicians, I would suggest that please help the patients and the community in which you are practicing to guide them as to what is authentic source of information, where they should look for the information. In fact, I would suggest that we all should create our own internal patient group if you have of your regular patients and guide them about the ongoing pandemic as and when the information is reaching you. So, what are the authentic source of information? So, as far as we are concerned, I think it's only the World Health Organization and the CDC, which are the authentic source of information as far as international news is concerned. The national, we have the Ministry of Health website, which gives updates directly from the Ministry of Health. For updates on any research related topics, ICMR COVID-19 is the website you should follow. At the state level, we have the Ministry of Health, which is again linked to the National Ministry of Health portal, so which updates directly again from the Ministry of Health. So a new app has been launched called the Arogya Setu. I would recommend that all of us should download this app and also encourage all the patients to download this app. This is a GPS enabled app which will give an ideas to which will track your contact with a positive COVID positive patient. If you keep the Bluetooth and the GPS on, if you come in contact with the person, even if it turns out positive at a later date, it will be notified to you. So these are some of the relevant helpline numbers. The Karnataka helpline numbers, 100 and 104, and these are the other numbers. It will all be there in the presentation. You can download. These are some of the other helpline numbers. One very interesting group has been created through Telegram app. So where the experts are from which are representatives of the government of Karnataka, they will answer all the queries through the Telegram app. So link is given here. And as far as if you are not sure whether whether news you are getting is an authentic or whether it's fake news, there are certain good websites. So one site, the WHO also has a site on Mythbusters. So any queries related to the myths associated with the pandemic, you can refer to that. And there's one more site called COVID-19 misinfo.org. If you click this, you'll see enter a dashboard which will give you, if you click on that news, it will tell you whether it is actually authentic or it's a fake news. So viewers, as family physicians, as a community-based practitioners, let us come together and help in containing this flow of information and channelize this information in a proper direction so that we are not overwhelmed with this information, which is causing a lot of anxiety among the population. So with this, I'll invite Dr. Roshni. So she'll be taking you through how to triage your patients and what are the latest teleconsultation guidelines. Over to Dr. Roshni.
Good afternoon, everybody. In continuation to what Dr. Mohan has said, I would like to mention here that we as family physicians should be cognizant of the risks that we face to serve our people. But at the same time, we should not forget that what is our moral obligation to the society, to the community. And on this note, I would like to say here that we are debating whether we should be calling patients to the clinic or shall we move on to teleconsultations. Well, I think we need to draw a line and balance it to the extent that we are able to do both, keeping in mind the safety of both ourselves as well as the community, so that we can contain the spread of this deadly virus, which is COVID-19. At this point in time, I would like to say, when we are talking about phone triage or teleconsultations, some of the skills that we need to acquire here is critical thinking, critical evaluation of the information that we have, and of course trust our clinical judgments, so that we are able to differentiate and understand whom to call to the clinic and who we can triage and do a teleconsultation with. With that, I begin the flow of the phone triage. Now, whether it is the urban setting or the rural setting, in both the settings, at this safe, when safety is of prime importance, as well as it is our duty as family physicians to cater to the burden of other diseases so that the patients are taken care of. So there could be various triage scenarios, which could be where the patient is calling the family physician. There could also be the caregiver calling the family physician. In the rural setup or semi-urban areas, the health worker too calls the family physician, or if the family physician has to refer to any other specialty. In phone triage, basically we have to assess, A, is it a life-threatening situation? So if it is a life-threatening situation, we reach out to your family physician immediately. If the family physician is not available, I would say rush to the emergency. The second two situations that could happen is if the patient is able to wait till they meet the doctor face to face, or can the patient be managed at home with a care plan. So in these two situations, B and C, we can see that can be managed with an initial video consultation. Now, at any point in time, if we feel that the patient needs to be examined or certain tests need to be conducted, or it cannot be managed over a video consultation, we need to see the patient face to face. This is just a triage form for reference. We are coming out with our guidelines in a day or two from the Academy of Family Physicians of India, and this will be available to each and every family physician for use, which basically states that you're going to greet the patient. Initially, the COVID symptoms need to be screened, like fever, the dry cough, any breathlessness, and if there is any other GI problems like diarrhea, or even nowadays we are seeing some skin manifestations. So we need to keep our eyes and ears very open and use our critical thinking skills as to who we should be sending to the fever clinic immediately or send for COVID testing immediately versus who we can manage in our clinic setting. Now, how does a teleconsultation help when you do it with your family physician and not any other doctor? First of all, if you have a regular family physician, he will be well versed with your medical history. And minor non-emergent medical problems can be dealt better on a televideo consultation. Therefore, we could also avoid a trip to the clinic or the hospital. We can also help you maintain social distancing and potential exposure to the COVID-19 during travel or visit to busy clinics. And in case there is a face-to-face visit required, it can always be arranged on a video chat with your family physician and in a scheduled manner so that there is no overcrowding of the clinics. Moving on, when we have to do a teleconsultation, we need certain information at the beginning, namely the demographics of the patient, very importantly, travel and contact. Now, we have been in a lockdown for about more than 3 weeks now. So initially we had the guidelines which stated that the international travel or the domestic travel was around 15 days, which we have extended to about 1 month now, as we have to be aware of the community transmission that could happen. So the travel or the contact history is not only pertinent to travel, but also it is important we take the history if anybody has been to a hospital, like for routine health checkups or even procedures like IVF where they have to be frequently visiting the hospital for injections, tests, etc. Another important point is whether they have traveled to any of the hotspots or have attended any public gatherings and even been to a clinic for routine consultation. Now, why we take this history is particularly, God forbid, if there is a positive COVID case, it is easier for us to track and do the contact tracing, and that is why it should be mandatory that we take this history. Comorbid conditions, as we know that because of lack of immunity, the elderly population is succumbing to the COVID infection. So because of the low immunity, it is important that we be well versed that, okay, they have these problems, so we have to take extra care, or we have to be on red alert for any little symptom or any new symptom or any red flags that they would have. Drug allergies is another very important thing as far as teleconsultations. I know in our clinics, when we do it face to face, we tend to take it down. But we should not be, as we are prescribing over telephone or over video consultation, it's important that we take note of the drug allergy of each and every patient. Nevertheless, coming to another important point is the consent. Now, many people do say that is it not implied consent for teleconsultation? The answer is, well, it is, but to be on the safer side, because there are legal aspects of the televideo consultations, there are restrictions, there are limitations. We need to have an explicit consent which should be filled up by the patient. So it can be through a Google form, it can be in your EMR, it can be also through the medical app that you're using for your video and teleconsultation. Charges again is dependent on the doctor, and of course from the face-to-face consultation I feel the charges should be less, but that is according to the doctor's individual decision. Again, reiterating on the consent and the declaration. The explicit e-consent can be either verbal, it can be through SMS, email or video, or it can be an interactive consent form where you actually write that I hereby give consent to be evaluated, keeping in mind the restrictions or the limitations of teleconsultation. Another question which comes up is, what if the patient is hiding information or is not sharing the correct information with us? Well, what we could do at the max is make them sign on a declaration form saying that whatever above information that they have shared with us is true to the best of their knowledge. But beyond that, if they are still hiding any travel history or contact history, I think that is a difficult situation to be in. Coming to the core teleconsultation salient features. Now, in general, as I mentioned earlier as well, that exercising professional judgment in understanding limitations is very, very important for us. And we must give a prescription displaying the doctor's registration number. These are the two must-dos. Now, initiating the teleconsultation, as we have already discussed, is by verifying the demographics and agreeing to the consent that must be taken. During the consultation, it is useful at this point in time if we use an EMR, because the documentation is very proper. And if we do not have an EMR, we can resort to handwritten prescriptions, take a photocopy, and then take a picture, send it on either email or through any other medium. The first consultation, as mentioned, is and must be a video consultation. Now, by first consultation, we also consider if you're seeing the patient for the first time or you know the patient for the first time, it is also mentioned that if a patient is not seen more than 6 months, that is also considered to be a first consultation. If examination is necessary, we do recommend video consultations. For example, if there is a skin rash, if there is an eye lesion, a video consultation gives us a better perspective, better understanding of the problem. And I also feel that in the examination, when we are documenting in the electronic medical record or our prescription, it's important that we mention the general condition of the patient. So that is the patient talking to us comfortably? Is the patient in a relaxed mode? Or is the patient looking sick? So that can give us an insight of the problem, as well as if we are referring, the other doctor too gets a perspective of the whole thing. Prescription rules. Now, the list O medications, which comprises of the cough mixtures, the paracetamol, the multivitamins, the ORS packets, these are all can be freely prescribed according to the guidelines. The list A and B, which comprises of the regular medications taken by the patients, for example, their diabetic medications, hypertensive medications, whatever they have, so which is considered as follow-up medications, can be prescribed if the patient is already taking it. The prohibited list definitely is the narcotics, the psychotropics, and the Schedule X drugs, which can be always referred to. It should not be prescribed over teleconsultation. Now comes to the question of antibiotics, because many a times to help our patients, we need to give antibiotics. The question is, should we give it or not? Now, the guidelines mention that in the first visit, unless absolutely there is a valid reason to give an antibiotic, we should not be prescribing it. Antibiotics should be prescribed only in the follow-up consultation and with a note mentioning what is the clinical finding or the clinical symptom that made you give the antibiotic. And last but not the least, we should not forget about the ethics of our practice, which is the beneficence, the non-maleficence, the autonomy of the patient, and justice at the end. And here, because we are doing teleconsultation, I would like to add truthfulness and confidentiality also has to be kept in mind. Prescription formats, again, can be taken in your personal prescription pad. It can be through your EMR, or it can be through the app which you are using to consult the patient. Safety netting, again, is very important. Irrespective of the case, two things that you should mention on the prescription is the red flags, which is appropriate for the case, and definitely your phone number for patients to reach out. The other thing is, make a general template of adding it to every prescription about the precautionary measures to be taken in the COVID-19 era, including hand hygiene, using of masks, etc. And again, I would like to reiterate, please don't forget to take the history of drug allergies and the history of last menstrual period in case of women. That brings us to the notification in case we are dealing with a suspect COVID patient, that we have received guidelines from the government of Karnataka, and this is the email ID that we need to send the cases if we suspect, or if we are seeing any fever cases or cough and cold cases. There is a format which has been shared. So we need to follow that format and send them the prescription, the notification accordingly. And at the end, before I end, I would like to say that as we use our skills, it is a difficult situation for us, but we should not back out, and we should volunteer our services as the frontline physicians to help out people, to educate people, as well as to take care of other diseases which are not COVID-19. And I would like to end on the note with Dr. Nelson Mandela's saying that education is the powerful weapon, the most powerful weapon that we can use to change the world. Thank you very much. I pass on the mic to Dr. Mohan again.
Thank you, Dr. Roshni, for very nicely bringing out how to triage telephonically, and what are the teleconsultation guidelines, and what are the important things you must understand while giving teleconsultation. Having learned triage and teleconsultation, when you are calling patient to your clinic, what are the protocols to be followed, how we are going to manage in the clinic, how we are going to adopt safety precautions, what are the protocols. To talk about this, I'll invite Dr. Sapna Bhaskar.
Thank you very much, Dr. Mohan. My duty is to tell about clinic management and also the wellness of GPs during this pandemic. These are my learning objectives in gist, like should you practice, first question, how to prepare for your practice, how to manage your clinic and staff, when to suspect and then notify, like Dr. Roshni was telling, treating, yes or no, and some just a little bit on how emotional, keep your emotional well-being, how to keep your financial well-being during this COVID. This is the notice from the Karnataka government, which very clearly said that very few days back this has come out, which says that hospitals, nursing homes, clinics, telemedicine facilities can function to prevent inconvenience to non-COVID patients. So a lot of non-COVID patients are finding it very difficult to find the nearest health center. They have forced to go to hospitals, and hospitals usually, the patient load is much higher, and they're knowingly unknowingly get exposed to sometimes patients or even carriers. So you all are justified in opening your clinic and taking precautions and seeing patients. Before you open your clinic, be aware of what is the latest national, state or local guidelines. Mind you, local guidelines might be different from even the state guidelines. There are hotspots. There are certain localities which need different guidelines. So you should be very aware of where you are and what is the guidelines followed there. You should also be knowing the help numbers, which Dr. Mohan has very clearly told. Make sure you know the places, the ambulance services in and around your clinics, and also the labs which do COVID testing in and around your clinic, because a lot of enquiries can come for that. Or if you suspect that a patient is, COVID positive, it's always better we directly tell them than tell them, you go and find out. It is our moral responsibility to address that query of the patient. People who are giving PPE equipments and disinfectants should also be there in your list of no's, because we need to have enough provision for giving PPE for ourselves, also our staff, and also disinfect the clinic. I will be talking a little bit in detail. Keep a good update on the IEC materials. They are very easily available on MOH website, WHO, CDC websites. So like Dr. Mohan was telling, you can always dissipate the proper knowledge to all your patients, your colleagues, and you can even sometimes display it. I will come to that. Dr. Soumya will be talking more about the community spread, how to prevent it. So she will talk a little bit. Here I have given the numbers of the BBMP control rooms which you can access to. We can always share it if needed. This slide is basically to understand why we should be careful during this pandemic. If you notice, the patient starts becoming contagious right before even the symptoms start. I won't be talking about symptoms. I think all of us know that. Even Dr. Roshni was mentioning skin symptoms, even neurological symptoms. But take this point much before the patient starts becoming symptomatic. They are contagious. So every patient who walks into your clinic or you are talking to, take them as a possible suspect of COVID, even if there is a minutest doubt of what the patient is telling you. Before you start your clinic, these are the three main things. One is triaging, droplet precaution, and contact precaution. Triaging, Dr. Roshni did tell you about it, and what she mentioned was phone triaging. I don't think there's much changes in phone triaging and face-to-face. The only thing is in face-to-face, your staff can be trained to understand which patient needs to be roomed in and which patient needs to go directly to the fever clinic or to the nearest COVID treatment center or hospital as per the patient's condition. So the triage model and the triage form will remain the same. It is just that it is going to be face-to-face. If possible, restrict your OPD timing and keep it different from your teleconsult timing. Let not it overlap. So like you give a separate time for teleconsult in a day and keep a separate time for your OPD consult in a day. You will also be free, and then there won't be overcrowding if there are more number of patients, and give sufficient gap. In fact, my suggestion will be keep a little more than what you normally give, so that the next patient comes only after this patient walks out of your clinic. So leave sufficient gaps. Definitely the flow of patients are much less, so there will be enough time for you to have a complete consultation and then let the next patient come in. How do you prepare yourself? Daily have a clean set of clothes and wash the clothes separately. If you're wearing a white coat, also wash it every day. Keep accessories away as much as possible, because they are they have fomites, and fomites are one of the places where viruses do tend to concentrate. Your hair is another fomite, so don't leave it loose, preferably tie it. And change your contact lenses to glasses for two reasons. One is it helps as a protection for you if you don't have a face shield, And secondly, you don't tend to put your hands in your eyes, which, many people tend to do as and when we get a little, sweaty and all that. So please change it to glasses. How to manage your clinic. Before you start your clinic, you should be having your support staff because it's not possible for you to run a clinic on your own. So make sure ID cards are issued to all the staff in the clinic. This is available in the nearest police station and also online. If you tell that it's an essential service, online passes can be available to your staff. They also need, you need to support them also through this. Educating the staff regarding COVID, regarding the proper PPE, proper triaging, and how your clinical services are changing in this time of the pandemic. This I will reiterate again and again because before the patient rooms in, it is actually the support staff who is going to do a big chunk of the work, on how to manage the patient. So make sure you spend enough time educating them about cough etiquette, masks, PPE, how to talk to the patients and their attenders, how to keep them away from crowding, social distancing. Everything should be very, very clearly explained to the staff in your clinic. Also, make sure the staff understands when to keep themselves away from the clinic. Even the slightest, fever or ARI symptoms, they should be quarantining themselves. So all these should be very clearly mentioned and spend enough time to educate them properly. Don the best available PPE that you have. Dr. Soumya will be talking in depth on that. Keep some alerts and posters at the entrance, and that also Dr. Soumya will be telling. Cleaning the surfaces and instruments is what I'm going to talk about soon in the next 2-3 slides. So at the entrance, make sure that you have people with appointment. Try and avoid walk-ins because they are patients whom you really don't know much about. Appointments is the best way to keep the patient segregated also. A checklist and declaration, Dr. Roshni did put it up. Checklists are also available in fever clinics nearby. So if you know the fever clinic near your house, if you don't know that, nearby PHC is one of the good places where you can get probably a checklist. You can make a checklist on your own and give it to your staff and educate them how to fill up the checklist. Preferably, the staff should be filling up the checklist with a pen, and the patient should be only signing the checklist, and that pen should be immediately sanitized after the patient signs. So let there be a very less touch technique when you're filling up the declaration and the checklist. If possible, you keep a separate entry and exit points. Let the exit also be a separate single entry and exit. Entry also separate single and exit also separate single. If it is not possible, just one entry and make sure there's no crowding there. Patient has to be walking in individually. Avoid ACs. The HEPA filters in the ACs acts as virus concentrators, and the viral load inside your clinic usually increases if there is anybody. So good ventilation, keeping the windows open. In fact, my suggestion will be keep even the doors open unless you want to do a private examination. Try not to let the patient touch the door, so that keeping it opening is one way where they don't touch the doorknobs, because those are those high potency areas where the viruses can be there. If possible, let your clinic assistant itself open the doors and close the doors, and close it only when needed. Minimal furniture in the clinic. Try to avoid magazines, toys, newspapers, pens, which people keep touching one after the other. So the lesser clutter, even your table should be as less cluttered as possible, your consultation table. If there are more than one patient waiting there, it's always better to ask them to wait in the vehicle that they have come in, rather than coming and sitting in your clinic. So better not to keep chairs in your waiting area. By chance you have to keep chairs, let it be at least 1 meter, 1.5 meters apart. So all this has to be done in your training of support staff. When the patients come into your room, avoid relatives as much as possible again. If it is a pediatric patient or a very elderly patient who, or a patient who's having a psychiatric issue or anything, just one attender come in. So it's always better keep one attender and the patient, preferably the patient alone. At the entry, make sure you're giving a hand wash if you have a bigger setup, or a sanitizer at the entry. And the patient should be using mask, towel or cloth. If they don't have one, you should be making arrangements to provide the mask to the patient or the attender who's coming in along with them. Inside your consultation chamber, again, keep the patient sitting at least 1 to 1.5 meters away from you. As far as possible, don't touch the patient. Thermometer should be a thermal one. BP measurement only if needed really. ENT examination is as much as possible a no. But suppose you have to examine the patient, keep the patient's face turned away from you. And if you have to examine the chest, go behind the patient and examine the chest. Patients most of the time come and show you old reports. Again, here, try non-touch technique as much as possible. They can just show you, lift up the, the things, or they can send it to you previously before on your social media or your EMR that you have. So you can go through it and then talk to the patient. Aerosol generation procedures like nebulization should be avoided. And as far as possible, try to give digital prescription and cashless transaction. I agree, it is definitely a challenge. Not everybody can do it. If you need cash, let there be a separate box and the patient can put the cash in the box there. And later on, after sanitizing, you can use the cash and take it. All reusable equipments like stethoscope, BP apparatus, the patient's seat, where after that the next patient comes, should be sanitized before seeing the next patient. How to clean your clinic and the surfaces. 1% hypochlorite solution is the what you should use to clean your clinic, and this can be easily made by your normal bleaching powder, about 30 grams approximately in 1 liter. Keep this for about an hour and take the supernatant solution and keep it in a bucket, or you can use it in those spraying equipments, even a bottle with a spray. All instruments should be immersed in the solution for 10 minutes after use and immediately washed in hot water, otherwise it corrodes and starts becoming discolored. Periodic cleaning of floor, surfaces, doorknobs and furniture. As I said, wherever there is constant touching of patients and relatives, those should be periodically cleaned. Now, how periodic? Most of the guidelines say twice at least, before you start your clinic and after you end your clinic. If there is a spill of body fluid or if there is a suspected COVID patient who has come and gone, then and there should be again cleaning. Spill of body fluids, the 1% hypochlorite has to be changed to 5 or 10% of, I think it is 5% of hypochlorite. So you should prepare a fresh solution for spilling of any body fluids. All housekeeping staff should be given gloves and masks, because whenever they clean, they are also potentially exposed to the virus. Now, after you finish your consultations and when you want to go to your go home or to your family, it's better to keep your things in the clinic, like your steth, your bag, your other accessories. It's better to leave them either in the clinic or in your car. If you have a garage or a lobby in your house, leave it there. Preferably call up your home and tell that you're going to be home, so that somebody opens the door and leaves it for you. You don't have to touch the doorknob there again. Straight go to your room, remove your dirty clothes and put it in a bag which is dedicated to keep soiled clothes. This bag can be washed in your normal laundry. Since you're already putting it into another bag, it can be washed with your normal laundry. Before you go, and interact with your family members, make sure you wash your hands and face. If possible, shower. Shower is the best thing. If not, at least wash your hands and face before touching clean clothes and before going and interacting with your family members. Some doctors who think that they're potentially more exposed or who have elders at home, they can choose to isolate from the family in a different room. But people who come into that room should not come at least for 3 to 4 hours after you leave. Only then somebody should enter the room, and cleaning of the room should be done using gloves. So it's a personal choice whether you would like to isolate or you can be interacting with your family members. This is a question which all of us have been asking and debating. So when you start your practice, should you take HCQS prophylaxis or no? As a routine, it is a no. So ICMR has come out with some recommendations where they say only those who are involved in treating suspected cases or confirmed cases or household contacts should be taking. The dosage is given here. Now, who is a COVID suspect whom you should notify? So this is a very dynamic thing. It keeps changing. So this is the latest that we could get through. Any patient with fever and ARI who has not international travel now, it is in any area or territory with a history of somebody having COVID or which has been reporting local transmission of COVID. Any patient with ARI who has been come in contact with a confirmed case. Symptomatic healthcare worker, irrespective of contact history, and asymptomatic healthcare worker or close family member who is in contact. Anybody with SARI. Now, ILI also has been recently coming into the picture. So any patient with, I think once we start practice, let us keep it in mind that any patient with just, ILI, like influenza-like illnesses, also be taken as suspects and notified. Anywhere where the test is inconclusive but the patient is still having symptoms are also taken as a suspect. So all these patients should be notified to your nearest fever clinic or your nearest BBMP control room or the email IDs which Dr. Mohan and Dr. Roshni have mentioned. This is just a little bit of scientific knowledge, what kind of cases we can see. Usually we'll see only uncomplicated illnesses and mild pneumonias. We usually don't have to take care of the others. Can you treat? As of now, it is no. But in countries abroad like US, UK and all, general practitioners are treating. So these are the drugs which are now usually used now. Hydroxychloroquine, azithromycin, a combination of it, protease inhibitors like ritonavir, tocilizumab, ivermectin, and plasma therapy. Antiretrovirals and tocilizumab has been showing very promising reports. Hydroxychloroquine and azithromycin has been little controversial, some good studies, some not so good studies. So all of us are in a very stressful stage now. We don't know what is going to be the future for a few months. Our clinics have not been opening. The family is stressed out. Every day my family asks me, did you see any suspect patients today? So how to keep yourself emotionally well? A good diet and nutrition goes without saying. And most doctors, I think our family and our friends always have this complaint that we don't spend time with them. So this is the right time. You get enough time to spend with them in anything at home. Games, music, meditation, exercises, you have all the choice. You can always invest your time in intellectual progress for yourself. Learn something new. It can be medical, it can be non-medical. Do a course on ECG, do a course on echo. Teach something if you're interested in, have a passion for teaching, make some videos and start teaching. You can write some blogs, write a research article, write a case report, create something new. It could be again medical, non-medical, where you have a passion for something. Limit your COVID updates. I think Dr. Mohan gave a very, very detailed analysis of that. You just open anything and you see only COVID updates, and many of them are negative. So limit it to positive and useful things. And we doctors always find pleasure in helping our patients. So don't stop that, keep continuing to help your patients. Our revenues definitely have come down. All of us know that. How can you actually generate some extra revenue, or at least a part of your revenue that you get? Teleconsultations is a very good source. What I see is there are some of my friends who do 28, 30 teleconsultations in a day, and I think that's a good revenue source. If you have a good setup for home visits, if your staff is trained for home visits, this is one for your regular patients you can always keep in mind, but make sure you do proper PPE and also precautions when you go for home visits. Vaccinations is a gray zone. Pediatric vaccinations, according to guidelines, have to be kept aside. But then since this is going to be an uncertain period, you can still give pediatric vaccinations, but with proper precautions. Influenza and pneumococcal vaccines are being told to be given now. So that is also a good way you can make. Some other alternate sources of incomes, like, some people have YouTube channels, some people are into shares. So that is, on what you would like to go ahead. So this is my last slide. I now hand over to Dr. Mohan again for the last session of the day.
Thank you, Dr. Sapna. You have done the triage and then you've called the patient to the clinic, and Dr. Sapna has very nicely brought out what are the safety measures you should adopt and what are the protocols to be followed when you call the patient at different areas in your practice area. And she's also touched upon how to keep yourself in a good mental state and how to take care of family and the community in this pandemic time. I just want to make a mention here that the AFPA, the Academy of Family Physicians of India, is drawing a consensus document on the consensus recommendations for practice management. Probably to be ready by the end of this week. Please remember, when you're calling a patient to the clinic, you're not just putting yourself the risk of acquiring infection, but also you're putting your staff, your family members, and most importantly, you're also putting the community at risk, your own patients who are visiting your clinic under risk. So taking all safety precautions is very, very important, and to enlighten us on what are the personal protection you must be taking on the PPEs, the personal protective equipments. Dr. Soumya will be talking about it. The personal protective equipments are not just for your own protection, as I mentioned, it is for the protection of anybody who is coming in contact with you, and also for yourself. And she will also be talking about how to guide your patient base and the community in minimizing the risk of infection. So over to Dr. Soumya.
Good afternoon, everyone. Thank you, Dr. Mohan. Now let's get into how do we ensure our safety as a frontline warriors so that we also prevent community spread, and what are the responsibilities of the general practitioners at the community level. What are these personal protective equipments? As you all know, personal protective equipments are protective gears. They are designed to safeguard the health of workers by minimizing exposure to any biological agent. The components of PPE could be includes goggles, face shields, masks, gloves, coveralls or gowns with or without aprons, head cover and shoe cover. Whatever you use, ensure a rational use. So this also applies to PPEs. Now coming to face shields. You know, the contamination of mucous membranes of the eyes, nose and mouth can occur through droplets which are generated by cough or sneeze of an infected individual, or during aerosol generating procedures at our clinic level like nebulization, or even putting a rinse tube in a terminally ill patient, or during change of catheters. It can also occur by us touching the eyes, nose and mouth with a contaminated hand. It is said that if we monitor how many times we touch our face, it nearly comes to about 2000 times. So we have to put a conscious effort in not touching our eyes, nose and mouth. So in this perspective, face shield and goggles helps us a lot. I would recommend family physicians this Spider-Man like face shield and goggle, because it has an inbuilt goggle, and many of our family physicians have spectacles and lens are not advised. Now masks. Respiratory viruses including coronavirus mainly target the upper and lower respiratory tract. And these masks act as mechanical filters filtering the virus, and the best mask available is N95 mask, and we also have triple layer mask. A little bit more in detail about N95 mask, because this is the one which is recommended for all primary care providers. N95 masks are of various sizes. It should be shaped in such a way that it should not collapse easily. And this is the most recommended mask because of its high filtration efficiency of more than 95%, and it has a good breathability with an expiratory valve, and it should be of a good quality standard. Like usually quality standards of America recommend NIOSH N95, whereas Europeans, they recommend FFP2 or FFP3. These masks should also be fluid resistant, and these quality masks will help a lot in preventing the entry of these respiratory pathogens. The next important, very important PPE is the glove. This prevents transmission from hand to hand or hand to face, hand to mouth, etc. There are two types of gloves. We have the commonly used latex gloves made up of latex materials, and it is known for a lot of allergy. And we have the other lesser known nitrile gloves. They are chemical resistant to sodium hypochlorite solution, and they are the preferred ones because they have less allergic tendency. Now coveralls or gowns, they create a 360-degree barrier from head to toe. They reduce contact from droplet exposure and also reduce contact, both of which are known to transmit COVID-19. Usually they should be impermeable and they should cover the entire specified area. We also have shoe cover and head cover. Shoe cover should cover up till ankle. The head cover should cover the entire head, including the hair or its accessories. Now we should know the proper technique of wearing these PPEs. First thing is that we should do hand wash with an alcohol based rub, or at least soap and water for a minimum of 20 seconds, followed by wearing an unsterile glove, then our gown or coveralls, followed by mask or respirator, then the goggles or the face shield, and finally a sterile glove. A word of caution, this whole attire is only required for family physicians who also do hospital visits or who visit suspects in their residence, and it is not recommended for all the family physicians as per the government guidelines. And one more important word of caution, when we put this entire PPE, it is advisable to have your snack break or tea break, and even complete your urinals before putting on the PPE, because once you put your PPE, you will not be able to take any breaks until you remove it. Now, how do we remove this? The order of removal is also simple. First, you remove your sterile glove, followed by goggles and face shield, and then the gowns, the mask or the respirator, and finally your unsterile glove. And always never forget to do a basic hand wash after this. And very important, we have to dispose these PPEs in the respected recommended bins. Usually, when we have seen a suspected COVID patient, it is recommended that we dispose these PPEs in yellow bin. Now, if you ask me what are the PPEs which I should wear as a family physician, or I should recommend when I work as a team in my practice area, if you're having a triage area where your aides are involved in triaging the patient, then they are at moderate risk, and definitely a N95 mask and a glove is recommended. Always encourage your patients who walk in to wear a mask, at least a cloth mask, as cloth mask is recommended by CDC recently. And if cloth mask is not available, at least prepare a paper mask and give it to them, so that a reasonable amount of aerosol generation can be prevented in case if they have any respiratory symptoms or if they are asymptomatic carriers. Next, coming to your screening area, that is a help desk or a registration counter, who provide information to the patient. They'll be interacting with the patient a lot, and it is recommended they also use a N95 mask and a glove. Similarly, if you have a screening temperature recording station at the entrance, you have to provide them a N95 mask and a glove. Similarly, in your patient waiting area or holding area, your nurse and paramedics are continuously in action in maintaining all the universal precautions as stated by Dr. Swapna, and hence it is very important for us to provide them also with adequate PPE. And also always ensure a minimum of 1 meter distance needs to be maintained. If you come to the doctor's chamber, where mostly doctors and physician assistant or nurses are involved, they are always at moderate risk, and they have to wear a N95 mask and glove. And do not encourage any nebulization procedures. You may have some asthmatics coming to your clinic in distress requesting for the same, but it is very important to train all your staff in your clinic, and also educate the family members of the patients in distress that nebulizations are not allowed in the clinics for some time. And always never forget your sanitary staff who keep the entire area clean. Do provide them with adequate PPEs, at least an N95 mask and a glove. Limit the visitors to your clinic as minimal as possible, but if visitors do come, always have triple layer mask, some spares of triple layer mask in your clinic, and always give these visitors so that they always enter your clinic after sufficient hand hygiene. All hospitals should identify a separate triage and a holding area for patients who come with influenza-like illness. And if there is no triage or holding area because of some resource constraints, it is advisable that you always follow universal precautions. I also see some of the many active GPs who visit even the hospitals, even to see the patients or to treat them. They have to wear the entire PPE, and not just N95 mask or gloves would be enough for them. Now, prevention and mitigation are the key measures for containment of this pandemic now. How do we do this? Performing hand hygiene frequently with an alcohol-based rub is very important, especially if your hands are not dirty. If your hands are dirty, you have to wash the hands with soap and water, whichever is available, for a minimum of 20 seconds. Consciously avoid touching the eyes, nose, and mouth. And for performing hand hygiene, you have a lot of videos and posters which are available. Probably you can post one of these posters in your hand washing area so that even your support staff will get used to all the steps of hand hygiene, and it helps in becoming more perfect with these simple basic measures. And also practicing respiratory hygiene by coughing or sneezing into a bent elbow or a tissue and then immediately disposing of the tissue into the yellow bin is very important. Wearing a medical mask if anybody is having symptoms is also very important. It is very important, as Dr. Swapna has stated, to train all your support staff who are attending your patients first on all these guidelines. Now, you also have to practice and educate about social distancing. Social distancing not necessarily mean staying 1 meter away from each other. It also means avoiding all non-essential travel, avoiding places where there are large groups of people, or limiting any gathering which has high risk individual. Now, what do you mean by community transmission? Community transmission happens when a patient who is not at all exposed to any known infected patient or who has not traveled to a country in which the virus is circulating tests positive for infection. Now, at primary care provider level, what are the steps which you can adopt to prevent this community transmission? First and the most important is have visual alerts at your clinics, at the entrance and all the strategic areas in your locality. You can also educate your community. You can give them handouts to display such visual alerts about hand hygiene, about social distancing, not only in the waiting area, but also near elevators, near provision shops, because many cafeterias are not yet open now. Many provision shops or whatever shops open as a educational tool. You can reinforce both the patient and healthcare workers the importance of hand hygiene, respiratory hygiene, and cough etiquette. It is not only the responsibility ending at the clinic level. You also have to connect yourself with local health authorities. I can give you an example of how it helps. If you get connected to your local community health authorities, you can work as a private public partnership and collaborate each other, help in a collaborative approach for augmenting each other work and helping each others. For example, if there is a patient who is a suspect in your community or who has been quarantined for some reason, you can probably act as a counselor and help the patient to stay back at home for quarantine. Home quarantines are one of the best options available as suggested by many studies. And you can also get connected to your healthcare authorities and help them in providing visual alerts and in patient education. For this, you can use various social platforms like WhatsApp or YouTube or your Facebook, and you can probably, as Dr. Mohan suggested, form a group of your community and try posting all these. This will also reduce their apprehension towards this pandemic. You can also, help other home-based health services and community organizations to assist with support services like delivery of food, medication, or other goods. You can also teach them how to sanitize and how to not to panic, but to be proactive and watchful. Next, you can also train your employees on checking any signs of influenza-like illness before reporting each day, because all of us are at risk of exposure, and notify to you if they become ill so that they can be given leave in adequate terms. GP should also train your staff on COVID-19. This I'm reinforcing because we may not be able to get over this pandemic shortly. It may take a couple of months for this pandemic to reach its uh, baseline. So we have to get connected to health authorities. GPs should get trained themselves on telemedicine and ensure teletriage and teleconsultation. We should educate public, create awareness, and also mitigate false infodemics. For this, we need to be updated. And another important responsibility of general practitioner is in notification. Uh, this is a small format which I have shared. This is recommended from BBMP, the local health authorities here, on how to notify all the cases of influenza-like illness or severe acute respiratory illness which come to your clinic, and keep the authorities updated so that we get connected to each other. Suppose if you inform your local BBMP authority about the suspected case and send them for a particular place for getting the testing done, obviously you will be anxious at the end of 48 hours about the result of the test, and the local health authority can keep you posted about the positivity or negativity of the report, and hence if it turns positive, then you have to apply all the quarantine rules. In short, GPs are the backbones of preventive healthcare. I have just summarized all the presentation slides on the role of GPs in community health and participation. Now, GPs are not limited in continuing their practice at the clinic level, but they have a lot more to do. This COVID-19 has opened a lot more responsibilities for general practitioners. Thank you. Over to Dr. Mohan.
Thank you, Dr. Soumya. In fact, Dr. Soumya has summarized the whole learning objective of this presentation. And she has nicely brought out what is our role as general practitioners in this hour of pandemic. She interestingly brought out a very important aspect about the personal protective equipment, that all general practitioners need not wear the PPEs. Because we have been discussing that we are not provided with PPEs, how can we open a clinic? So it is not required to be worn all the time. It is required only when you are, as she rightly brought out, when you are doing some procedures, or maybe when you are coming when you are visiting the hospital to see your patients. So only those protective equipments which are actually required to be worn all the time. She has brought out the N95 mask, the gloves, and the probably the head shield with the goggles. Okay, due to positive time, I think we'll just run through these slides. So now that we are almost, okay. So after COVID, what? So probably things will change, the way we practice will change, the whole healthcare scenario post-COVID will change. Firstly, we hope and pray that it ends soon. So some of us are very optimistic that it might end in 2 months, but you never know, it might take longer. And also probably what it has taught us is that we should be better prepared for the next pandemic. And at the global level, probably we have learned how to treat the world as a whole. There is no boundaries, no discrimination for the virus. And also the role of WHO might change the way WHO deals with the pandemics and deals with the health issues of the world will change. And definitely there will be more and more research on the new viruses. And at the national level, probably the government policies and on public health will definitely change. The planning, funding definitely might, the healthcare funding might jump from, say, the existing 4% to maybe 8 to 10%. And there'll be focus on the public health facilities, the hospitals and all will be upgraded. And the perception of the community toward the doctors also, I feel, is going to change. So the behavior of the community to the doctors, suddenly with this pandemic, the doctors, the medical professionals have become sort of heroes, and the entire nation is looking, entire community is looking up to the doctors as saviors. So probably the behavior toward, and the doctor-patient relationship also will take a major change. And probably we need to um, learn to play different roles in such kind of scenarios. Maybe we'll have to undergo certain courses on telemedicine, maybe on practice management. And definitely technology is going to come in a big way in practice of medicine. So probably we'll be dependent mostly on high-speed internet, teleconsultations, and it is perceived that probably face-to-face consultation will come down drastically. But personally, I feel that the doctor-patient relationship will be the center of your interaction with the patients. So face-to-face consultation will continue, but maybe it will be routed through the technology and teleconsultations, which ultimately will result in face-to-face consultation. Okay, so we have half an hour for question and answer sessions. So one question is, according to Government of India telemedicine guidelines, anxiolytics are not allowed to be prescribed. In today's scenario, we are getting maximum teleconsultations for panic and anxiety. Isn't this fighting without weapons? Dr. Roshni, this is for you.
Yeah, so I do agree that yes, there's a lot of anxiety and panic which is there. So again, we have to have a proper reason documented to prescribe. But if the situation is such that we have to prescribe and the patient is not a COVID suspect, I would say you can call the patient, examine, and face-to-face you could prescribe it.
Okay. So as per the guidelines, we are not supposed to prescribe
on tele.
on
Yeah,
teleconsultation.
yeah.
So next question is, why the government is not using private doctors if something goes wrong and doctor dies due to COVID-19? The question is not well understood.
They're wanting to say that why they know
why the government is
for
not
private
insuring, sorry, not
insurance.
so why the government is not insuring private doctors if something goes wrong and doctor dies due to COVID-19? So
I think I'll take that. There is
Yeah,
a
Dr.
Pradhan Mantri, I think Suraksha Yojana or something, which has come up in last week or a week before that, where every doctor is again categorized into A, B, C, D, and E. So category A is for those high-end hospitals, intensivists. To category E is to us, private practitioners who have little lesser risk than those in the hospital. So there is a new insurance which has come up. You should probably contact your maybe the nearest health center which can help you, or probably look up online for this, apart from your indemnity insurance or whatever you have separately which you have. Anybody else who knows more about it? As far as I know, this is what. So we would preferably be in category C, D, and E, where category C is, I think, those who are seeing more cases who are suspects. Category D is who are doing procedures, and E is only for outpatient. There are, I'm not exactly sure of the wordings, but we definitely will come in that.
but if it is established that the death of a medical professional is due to COVID-19, the insurance
Goes up.
will
So
goes
now,
up.
day before yesterday also, there has been a new ordinance, I think, that the insurance amount, the doctor who dies in the field of duty will get a much, about 50 lakhs if I remember, as the compensation amount.
And what I was trying to bring out is that even if it's not covered in the present scheme,
Yes.
so
Still.
suppose if there is a death of family physician, definitely he'll be brought under the
Yes.
insurance scheme.
That is
And
what
there
I
is a
want
proposal
to-
to bring all the medical professionals in the insurance scheme.
Yes.
Even the dentists have requested that they also should be brought under
Family.
this, the latest one.
Yes.
Okay. Other than RT-PCR, what other tests can help in? Other than RT-PCR, what others can help in support of COVID-19? Probably what he's trying to ask is, what is the ICMR guideline on the other modes of testing? Dr. Swapna?
Consultants, yeah. RT-PCR is still the best test to do, which should be done in the first 7 to, I think up to the first 7 days. After 7 days, there is antibody testing, IgM and IgG, but they are recently there are a lot of papers telling there's a lot of false positive and false negative. So sensitivity and specificity seem to be very less. So the government is kind of taking it out. The advantage of antibody tests is that this is like your dengue test where you get the positivity within, some of them even within 15 minutes they give, some of them give within 2 hours. So there are some rapid kits which gives within 5 minutes, like your pregnancy test, your tropi test and all that. But mind you, the sensitivity and specificity is very, very low for those. So the government has taken off the approval of this particular testing after these studies. RT-PCR still remains the mainstay of testing. Although the results come a little late. It takes 24-48 hours for the results to come. But still, that is the best test you can do now. I hope that is what the question was on.
I hope that answers the question. Telecommunication is a very good idea, but as in India, a developing country, and most of the patients don't have access to internet. And those who have internet don't know how to pay online. What do you do in such situations? I think Dr. Roshni has already covered this. So again,
Just to reiterate that, I think he's asking in context of rural practitioners, and I do understand that there is a challenge, and that's why I think telephones, mobile phones everybody would have these days. So even if it is not a video consultation, we can do a teleconsultation. And most important is the awareness about the teleconsultation and why the doctor is forced to do it at this time is important in the rural areas. And I think it is being taken care of also, and that is how it is catered to.
as far as the payment mode is concerned, I don't think that is a major issue. No,
Yeah.
most of the people, even the vegetable vendor is also now well versed with
Paytm,
Paytm and other
Google
wallets.
Pay, yes.
So that should
Yeah.
not be a major issue.
And with respect to the consent, suppose even the local village heads, like the village panchayats who are little educated, can help the members, and this villager can also approach the primary healthcare center where the primary doctor, primary care provider can act as a connecting link for the teleconsulting physician as well as the patient.
Any new technology will take some time for people to adopt. Like I always say that even when the ATMs were introduced, people were not very comfortable, but these days everyone uses the ATM. So even the rural areas, probably these wallets have already been being used, and they are going to be more popular.
And if you're very sure that the patient is not a suspect, then such patients can be seen for face-to-face.
Yes.
After you finish your triaging on phone, you can just use your normal phone lines, speak to the patient, triage them, and then if you're clear, you can ask for a face-to-face consultation.
Okay.
I will just tell the categories because offhand I couldn't remember. Category A is for fever clinics and triage, which we are not going to do as general practitioners, so that's not there for us. Category B is for non-critical COVID admissions. Category C is for critical and non-critical COVID admissions. Category D is for telemedicine, so we can always be there. And category E is for OPDs and non-COVID admissions. So I guess we will be falling under category D and E. That is what I was mentioning as telemedicine and normal OPDs. So just wanted to clear that.
How to get the updated guidelines for teleconsultation from AFPI is a question. Okay. So I've already mentioned we are coming out with the consensus. I won't call it as guideline. It is a consensus recommendation of AFPI. Dr. Roshni is working on that, especially on the telemedicine aspect. Let's hear from her only
I think two ways. What we have learned is from the Telemedicine Society of India, they have been continuously conducting courses, which is very useful. And this tells us about the basic content, what we should know, as well as the legal aspect of it. So I would recommend that everybody does attend that course. That is one. As far as AFPI is concerned, yes, we are coming up with a consensus document which will have the telemedicine salient features in respect to our consultation and our practice. So that will be circulated to all the groups.
Okay. Please tell us more about AFPF COVID-19 helpline.
I think
Okay.
Roshni can only do that because you are.
Yeah.
So this is basically a helpline to reach out to the general public to solve their queries. It could be clinical as well as non-clinical queries. Initially, it was set up because there was a lot of panic associated with it. People didn't know small things like, or all of us we were not knowing how to wash vegetables, what to do, how to put on the mask, but also there were many queries, and that's how the thought of the helpline came up. And we are not really prescribing as a telemedicine platform there, but we are giving general advice there. Of course, I think the team is coming up with another teleconsultation platform in time to come, is what I understand. And if anybody wants to volunteer, they are more than welcome. So Dr. Idris and team need to be contacted, or even I am one of the volunteers, so, or Dr. Mohan is one of the volunteers, so we could all join in and you could contact us on the main group.
Yeah, I would like to say here that it is totally run by, somebody has asked, is this helpline run by family physicians? It's totally run by family physicians. All the volunteers who are giving the time are the AFPA members. It is also linked to our AFPA resource website called the Be Fight Corona.
Yes.
So people have the option of visiting the website and learn all about all the authentic source of information are all put in this website. And we use that resource to answer the queries of patients. Doctors can really work as heroes if there is a good protection from law. Any laws that will be implemented on contrary safeguard doctors and doctor abuse.
Just came out, no? Day before yesterday, there is
The
this new ordinance that
ordinance.
Anybody want to take this question? Like, are there
Yeah,
any?
because day before
Yeah,
yesterday
so
only
the
the new
ordinance has been
come.
passed. So I think we are hopeful that this ordinance is
Yes.
not limited to
Only
this
6
period.
months, yes,
Yeah.
yeah.
So that's.
So hopefully this ordinance will change into a law. Until unless it changes into a law, we cannot say, it's going to be long term. Currently, it is going to be there till definitely for 6 months or till the pandemic is on. Once the pandemic is off, then we have to wait for the government as to what they do next with this ordinance.
Okay, it's a very interesting question. Small clinic 10 by 10, no assistant or staff. What should I do? What kind of precautions? So I'll put this to Soumya. But before that, see, the safety precautions and the protocols all depends on how we are organized in a clinic. So I think most of our practitioners have a standalone clinic, have a very small place. So it's very difficult to have an exclusive triage area. And I saw one of our AFPA members who had posted a photograph of how he's following triage and social distancing in his a small clinic. So he's put the waiting area outside the clinic. He's put the chairs about 2 meters distance, and the doctor is sitting at the entrance itself. He does not have a staff who can do the triage. So he himself is doing the triage. He himself is filling that declaration from now, and he's not allowing the patient. He'll take only the patients who are required to be seen will be taken to his consultation room.
Preferably put some posters outside your clinic itself where you're clearly mentioning that fever cases should be going to the nearest fever clinic so that patients are aware that they don't come to you. If at all they come to you, make sure you're seeing them at a distance of at least 1.5 to 2 meters. So even if the patient and they are wearing masks, so there are people who come and sit without masks. You know, if you don't have a triage room or something, keep some masks with you, give it to the patient immediately so that they start wearing the mask even before they communicate with you. That way you're sure that, you know, double protection from your side and their side, and distancing in the first instance. Then what Mohan was telling,
it's a
once we
little
triage,
challenging as far as triage is concerned and maintaining social distancing. But all other protocols can be easily followed in a smaller clinic than in a bigger clinic.
the cleaning, the the protection of the clinic and all, it holds good however big the clinic is or however small the clinic is. It all, in fact, smaller the better.
Okay, this is another concern. With the cost of disinfectants, sanitizer, masks, etc., with the expected decrease in flow of patients, doctors will be forced to charge higher fees. Are you justified?
Not all disinfectants are costly. Even a simple
Bleaching powder is...
Yeah, bleaching
even
powder.
bleaching powder is good enough for all types of disinfection, and even for hand disinfection you can use simple soap and water for a minimum of 20 seconds. When wisely followed, it does give adequate protection. And
Yeah, so probably what he's referring to is, like we already brought out, like if you have to wear a complete personal protective attire, so that will be very expensive. So, but it is not required. And yes, okay, even the N95 masks and sanitizers will add to your cost. Maybe we are justified in slightly increasing your consultation fee, which I'm sure the patients would understand. This.
One more thing is, we can use these PPEs in a very judiciously. You can buy 4 sets of N95 masks, put them in separate bags, and on day 1 your N95 one will be used, then it will be kept in the paper bag. This and second mask and third mask will be used subsequently. This day 1 mask will be used again, reused on the 5th day. Like this, you can reuse your mask for about 3 to 4 times without affecting the quality. And anytime your N95 mask gets fogged or you are not able to breathe properly, that is when it is not fit to be used further and it needs to be discarded with adequate precautions.
It's definitely difficult times we are going through. The overheads are going to increase and the flow of income is reduced. So I think you are justified in increasing to at least make up for the additional cost. I think the...
And you can educate your community also on using cloth mask, which is definitely recommended by CDC. I just read an interesting article where they say that even the poorest of the poor can be advised to use a face mask. If you ask me how, just advise your patients to, put rubber bands to nicely cut pillow covers or t-shirts materials and convert them to masks, because they definitely provide an above average protection than the other materials, because these are made up of 100% cotton.
Okay, one question related to this. Are N95 masks reusable? I think Dr. Swami has already answered this question. How to sterilize them? Is there any method by which we can sterilize N95 masks?
See, N95 as per the guidelines, if you look at the All India Institute of Medical Science guidelines, they say that you have to put them in 4 bags, and each N95 mask you have to label your particular bag as day 1, day 2, day 3 and day 4 and keep reusing it. There is no separate disinfection mechanism for it, because
it's not required. Maybe you can
it is not required. You can probably even keep it in the bright sunlight if there is a possibility, because it does help in definite disinfection.
So it is not to be microwave. That is
it cannot be microwaved.
No washing
no
as well.
washing as
washing.
well. No washing and drying, or not putting it in sodium hypochlorite.
Every time you wash, the fibers get separated. So the
efficiency
of the fibers,
yeah.
the effectiveness of the mask comes down.
One question is, how do we address gynae issues, menstrual abnormalities, without examination? So gynecological, Dr.
I
Swami?
think there has to be a face-to-face many a times, but I think history definitely in 60 to 70% of times history will help you to understand what the patient is, and definitely you can give
And-
most of the times. But if you
Yes.
need face to face, you are always, it's okay to do it provided you are sure that the patient doesn't come into an ARI or an ILI kind of
Yes.
symptom. So once you are sure the patient doesn't have ARI or ILI, you can ask them to come to your clinic and do your gynec examination.
And you can also use a double glove during
Yes.
examination
Yes.
along with N95 respirator and a full coverall if you have any. A full coverall is required for any aerosol generating procedure.
So one thing we all must understand is that just the teleconsultation is basically to do the triage. After doing the triage, if you don't suspect any possibility of COVID, or if you rule out ILI or SRS, you can always call them. In fact, the face-to-face consultation is the best way of consulting.
That is always gives the emotional bonding
Connect.
between the
Yes.
patient and
Yes.
the doctor for sure.
So there is no, we are not recommending that you should not have
Yeah,
face-to-face
yeah.
consultation. What we are saying is that do the triage part in teleconsultation. Maximum thing what we can sort out in teleconsultation, try
You
to
can
do
do
that.
it, yes.
Let's call
Beyond
them
that,
back.
you can.
Okay. How do we notify BBMP office about ILIs? I think this has
We've
been
shared
covered
this
by
has been covered,
many people.
Extensively, we can repeat the slide for their benefit.
Okay,
along
please
with the
remember
headings.
that you need not, we clarified that you need not notify all cases of fever. There was a question from within our group, which was doing the rounds, that all fever cases needs to be notified. That is not the, as per the circular by the Commissioner of Health, only a suspected case of COVID, you know the definition of COVID suspect case, and all patients with ILI and SARS symptoms, ARI should be notified.
So the
And nil report is
best-
not required.
Yes.
Nil report is not required.
The best way would be to get in connect with your nearest PHC or your nearest fever clinic. So if you have the connection of those two doctors, like your PHC doctor or your fever clinic, any doubts you can always talk to them or send the patient there. So our moral responsibility will be done if there is any doubt.
Okay, I'm doctor and quality manager. I am a doctor and a quality manager in a diagnostic center. Any specific instruction for diagnostic centers?
Okay.
I can take up the question.
Dr.
See, at diagnostic centers, definitely you will be receiving a lot of samples which could be suspects. All samples can be treated as suspects unless proved otherwise. So it's like how you handle all the samples with all the universal precautions. You can take and apply the same universal precautions. In our hospital to which I'm attached to, in the lab, we have advised all the lab personnel to wear complete set of personal protective equipment. This is also applicable for all the lab franchises which community physicians or even primary care providers can be associated with in their clinics. It is definitely required for them to wear adequate PPEs and follow all the universal precaution. This will include even all the lab personnel who are involved in collecting the sample and transport of materials.
Okay, more relevant here is most of the family physicians are using the phlebotomy services. We are
Yes.
linked with some laboratories. So we need to have a definite protocol for collecting the samples at home and in the clinic.
Yes.
So what we recommend is that what I am following, what most of us are following is, have a separate kit for each sample collection. Have a sterile bag. So have the vacutainers, syringe and your needles, everything separately, and use it for one patient only. For each patient, have a separate this thing, and take all safety precautions, especially when you are doing a home sample collection. Preferably call the patient unless they are bedridden. Call the patient outside so that don't go inside, and use a new pair of gloves and a surgical mask, maybe a new surgical mask for each patient.
Yes.
So these are some of the safety precautions and protocols you can follow as far as collecting the sample is concerned. Most of the labs, all the reputed labs, they have a protocol in place for transport of the samples as well as how they handle in the laboratories. So what you should be concerned is more about how we are collecting the sample at our end.
And another important point is when they are going for home sample collection, it's a good idea to find out if anybody is sick or having cold and cough symptoms, if there is any elderly people or any children at home. And accordingly,
absolutely, it's a very valid point. Probably we can have this in our checklist of
Yes.
when we are collecting the sample.
yes,
Maybe a self-declaration form that none of
Yes.
our family members are having
Yes,
any symptoms. It's a good idea.
In fact, I didn't put this point of pharmacy also. There is actually a separate guideline for
Yes.
pharmacies
Yes.
attached to clinic also. Main thing is social distancing.
Yes.
So when you open the pharmacy, make sure that the patients are not crowding there. And the pharmacist can just wear the N95 and gloves. That is all, as Dr. Soumya said. Social distancing to make sure that at least 1 meter apart, you can put those squares
Yes,
which everywhere it's
circles or
written, those
squares, yes.
red squares or circles, and make sure. So you can even run your pharmacy if you have an attached pharmacy. You can even run that, provided you take the precautions, the normal precautions.
Any specific? Where can we get good N95 mask and triple layer mask now?
Oh God.
N95 and triple layer mask are available in various websites. Probably what you're concerned is how, what quality standards do they maintain? How do I know which is a good N95 mask, which is a good triple layer mask? Probably that is your concern, because a lot of things are available even on home delivery services. So if you want to know exactly the quality standard and if you want to check it and buy it, you have to visit Ministry of Health, Family Welfare, Government of India website. Go to the section of PPE. There they have included certain quality standards in that particular section, and you can check with these standards and then buy. Usually these are certified by National Institute of Occupational Health and Safety guidelines, and also some European safety chapters. And the particular codes are also mentioned in this website. You can have a look at it, note it down, and then you can think of buying from a reliable website.
Okay, can we not direct all URI, ILA cases to fever clinics and only see other cases in own clinics? This will minimize the risk of all healthcare professionals coming under the risk of getting exposed. Can it not be advertised as such? Dr. Sapna.
Yeah, I think this is a very personal choice. We have a moral responsibility towards our patients also. You just can't shun them out just because they say I have fever. And not every fever is COVID
Yes,
again. So,
exactly.
And if you do that, firstly, the fever clinic will be overwhelmed one, and they have chances of acquiring infection more in fever clinics than in your
yes.
own.
So you're
Yeah.
unnecessarily
Yes.
exposing a patient who is probably not having COVID by sending them to a fever clinic and then probably exposing, especially if it is elderly and all. To the best possible capacity of yourself, it's just a personal thing, there's no guidelines. I feel we can taking the proper precautions. As long as we are taking the proper precautions and your clinic is taking the proper precautions, we will not become, carriers, or we will not become, like we will not contribute to spreading the disease. That is what I feel. But it is clearly a personal choice. If you don't want, you can
While
say
we are
that
In all
concerned
cases-
about the safety of healthcare professionals, we should also be concerned about the
Our own
safety of
patients.
our own
Yeah,
patients.
yeah.
And moreover, all patients coming with fever with URTI or LRTI are not COVID.
yes.
Yes.
Definitely. Otherwise, we'd have had
So
a catastrophic
yeah,
pandemic.
I'm still seeing dengue patients. I'm
Yeah.
still seeing typhoid patients. So
Definitely.
yeah, so
That's
we
where
are
yeah.
exposing them more when you send them to fever clinics. So
As
it's not-
passionate
yes,
general
it's not-
practitioners,
it's not
you
very
cannot
bad on
shed
our
the
side
patient.
to understand and then accordingly triage. When we
Yes,
feel
yes.
there is a need, then send. Otherwise,
Yeah.
don't send.
Okay, is there any specific site for healthcare professionals to get updated? In my presentation, I had given the link to most of the authentic
Reliable.
sites, relevancy. But if you want to get everything in one website, please visit BFight Corona of AFPI. This has the link to all the authentic sources of information.
Yeah.
Can we open the clinic in the containment zone? It's a very pertinent question. I think Dr. Soumya, who is working with BBMP, will know this better.
Yes, yes. See, definitely you can and you should open your clinics in the containment zone, provided you take adequate precautions with your personal protective equipment. You have to give the entire PPEs. I would suggest if your clinic is in a hotspot area in the community, or if it is in a containment zone, and it becomes your moral responsibility also to screen all the people in the community who have a lot of apprehension, because when they say that yes, there is a case of COVID-19 who has been quarantined in the community, even fictitious cough will start among many of the general publics. Many will have psychological issues, psychological stress. They would want to come and meet. And definitely, as primary care providers, we have a lot of role in educating them and mitigating their sufferings, and also giving them psychological support, and most importantly, examining them, triaging them, and sending them to necessary centers.
Okay, sir. I think we are done. We have, I think the questions are also, those are all repetitive questions, so we'll leave it at that. And we'll hand you over to Registrar Evaluation of Rajiv Gandhi University for Health Sciences. Over to you, sir.
Namaste. I'm Dr. Lingegowda, Registrar Evaluation at RGHS. I'm extremely thankful to all the participants who had logged in for today's this video conference meeting. The role of general practitioners, so-called family physicians, is really important. You are the one who will touch everybody in the remote areas of our state. I'm sure all of you will be facing several queries from the general public when they approach you in the remote areas. So in this regard, our university is conducting several programs, and today being for the family physicians, I'm sure whatever doubts you have, please feel free to ask us, and we are there. And whatever discussion has taken place today, it will be uploaded in the Facebook and YouTube. Please encourage your whoever asks the queries not to believe this WhatsApp university. I'll call this as WhatsApp university because every minute 2-3 messages, different messages are coming that professor from Japan and Nobel laureate from Germany. Never believe all these things. Believe only ICMR guidelines or circulars issued by Government of India and Government of Karnataka to clear the doubts. We are here to share the knowledge, not to share and not to confuse people. Please, whatever doubts you have, because we suppose if you are in the remote area of Bidar district, if you are remote area of Karwar, as a doctor, you'll be asked, doctor, I'm scared of this COVID-19, how to face the situation. I'm sure your role makes a lot of difference. You are going to play a significant role, and today our resource persons, I'm sure they have cleared most of your doubts, and university is ready to conduct this kind of programs even in coming days. Please feel free to ask the university, and I'm extremely thankful to all the resource persons today. We have joined hands with the university to share this knowledge, and feel free. Thanks everybody. Thanks. Thank you.